All right, folks, again, this is Amanda Pierce-Kelly with NAC, and I am so excited to kick off National Health Center Week planning with this webinar that we have been hosting annually, just to give everybody sort of an inside scoop on some of the things that you can do to make sure that you're hosting a successful National Health Center Week event. So we're going to get started here. I'd actually like to introduce a very special supporter of National Health Center work, Holly Hutchins, who's with McKesson. She'll speak a few minutes about her role in supporting National Health Center Week via McKesson, and then we will jump into the training portion. And then I'm really happy to share that we have a couple of health center folks, Felix Aguilar and Nina Vaccaro, from out in California. We'll give a proper introduction to them as we get closer here, but who are going to share with us the steps that they took this past National Health Center Week in 2013 to put on just a fantastic set of events and really speak to the steps that you all can be taking back home to ensure success in your communities. So let's go ahead and get started. National Health Center Week, just as a refresher this year, it's going to be August 10th through the 16th. We hold National Health Center Week in August, typically the second full week in August, so that we can leverage the fact that there is a congressional recess for the entire month of August. And we'll get into this a little bit more later, but just for anybody who's wondering, geez, why do we do this in August? It's hot and it's vacation and, it's getting close to back to school time. There is a method to the madness in terms of the timing for National Health Center Week. We really want to increase the likelihood and the opportunity to be interacting with members of Congress in person at the health center while they are home on congressional recess. And fortunately for us, they take that entire month off. And so that was the original starter to why we launched National Health Center Week that second week in August. So moving on. As I said, I want to pause here first to recognize just an incredible supporter of National Health Center Week. McKesson is our premier sponsor, and we are lucky to have Holly Hutchins, who is the Senior Marketing Manager for Strategic Segments with McKesson. She's been with them for 2.5 years and has worked previously in lots of different roles in the pharmaceutical industry for about 15 years. She comes with a wealth of experience, and I know she has really enjoyed having a chance to work with health centers. Before I turn the mic over to her, I just have to say that because of McKesson's support, we are able to support so many local events with small local grants and local event sponsorships, and McKesson has just been an enormous supporter of health centers, both through National Health Center Week and more broadly. So we owe them a great debt of gratitude for helping us to build the visibility and the success of National Health Center Week across the country, but certainly local in those communities as well. So Holly, are you live on the phone here?
I am. I'm right here.
Great.
So thank you, Amanda. Perfect. I certainly appreciate that glowing introduction. I'm very grateful for that. So as Amanda said, I am brand new in the role in the marketing component from our strategic markets. As we have gone through our integration, I know many of you have partnered with Legacy PSS, and we're now at the point where both Legacy PSS as well as McKesson Medical Surgical are both operating under the McKesson name. And so that may be something new and getting used to. I'm very fortunate also to be working with a name that is probably very familiar to you in a number of different CHCs, and that's Erin McLeese, who is going to be working back in the marketing. She can't speak more highly of how wonderful it is to work in the CHC space and what an honor it is to support such a great cause and partner with such a great group of individuals. McKesson, we've been the exclusive partners of National Health Center Week since 2010, and nationally we partner with a little over 10,000 CHC sites and systems, but specifically for National Health Center Week, in the past we have sponsored grants at over 30 events last year, and we'll repeat that again this year, but also participated in another 95 events last year. And as the new kid on the project, I'm definitely looking to grow that this year. So we've assisted in health fairs and open houses and appreciation dinners and set up patient screenings with some of our supplier partners. And we'll be working with Amanda and her team there at NAC to help us identify which of you really need help and would like our help and assistance with your events at National Health Center Week. But I encourage you to let them know what you've got going on, as well as to reach out to your local McKesson rep that you're working with locally, and let them know how they can help, and they will certainly filter that up to Erin and I so that we can continue to partner with this week. We know that this is an important week in your communities. It is a great way to help drive recognition and patience and advocacy within the local community, and we want to make sure that we are there with you so that we can help you to be successful in your missions of serving patients. So thanks, Amanda, for the opportunity to speak with everybody, and we're absolutely looking forward to partnering on this week.
Great. Thank you so much, Holly. And as Holly said, definitely be in touch with me and certainly with the rest of the advocacy team. There are some local grant sponsorship opportunities for everybody on the line, but the best way to make that happen, to connect those dots, and we'll go through this a little bit more as we get into the presentation, the best way to make that happen is to communicate to us, to post your events on the National Health Center Week website so that we know what your plans are, and then we can put you in contact with McKesson and hopefully make that connection for a local sponsorship opportunity. Unfortunately, we can't guarantee it for everybody, but it certainly does improve your chances if you let us know what your plans are, and the best way to do that is by posting your events on the Health Center Week site. So again, let's just get started. Again, I'm the Director of National Advocacy at NAC, and this year's theme for National Health Center Week is Celebrating America's Health Centers, Local Engines for Healthier Communities. I want to pause on the theme, and the reason for that is we try to establish a theme for National Health Center Week year to year that can serve as a hook for some of your events that hopefully you can use to sort of build your events and to serve as a little bit of a public relations tool for you guys to talk about all the really great work that's going on at your health center and your community. So local engines for healthier communities, the great thing about health centers is that for you guys, you know better than anybody, you're doing the hard work on the ground, but there's so much to celebrate in terms of the fantastic work that you're doing. You are large employers in your communities. You are driving a lot of business locally. These are really powerful, impactful components to the health center world that we don't always necessarily really tout, but they're important. And so that local engines piece, I'd encourage you guys to think about how you fit into the community at large and what you can do to point to all of those valuable assets that you bring to the table. The healthier communities piece, that's open to interpretation, but I think the other piece that I think of when I look at this theme is that the quality health outcomes that come from health centers, just the tremendous care that you guys are providing to your patients, and the fact that we stand up to every provider out there of primary care and are providing among the highest quality, those are other things that you should really be shouting from the rooftops during National Health Center Week. And again, we hope that you can take advantage of this year's theme to showcase some of that work that you're doing. If not, that's fine too, of course, but we do try to be creative year to year. Sometimes we're more successful than others. But again, America's Health Centers, Local Engines for Healthier Communities is our theme this year. We're excited to use that to expose all the great things that you guys are doing on the ground. So I talked a little bit about posting your events on our National Health Center Week website, and for some reason, some of the graphics that are in this slide set are not coming through, but we'll proceed. There is a section of the National Health Center Week website specifically for posting your events, and what happens is that they populate a map of the whole country. What we do is we look at that map. Oh, we've got some background noise. We take a look at the events that are posted to the National Health Center Week website, and that's honestly what we use to try to make connections, as I said, for local sponsorship opportunities, whether it be working with our national sponsors or from NAC directly. But the best way, again, to get that information to us is by posting your event on the National Health Center Week website. The other thing about posting your event is that as Health Center Week has grown, quite honestly, a lot of our elected officials, certainly our members of Congress, sometimes the media, and other community partners, they are now taking a look at the Health Center Week website and looking for events in their local communities. So it's become a resource way outside the bounds of what I call the usual health center suspects, or our usual community. So it's not just for the sake of, potentially plugging yourself into a local sponsorship opportunity. It also helps to get the word out nationally, and you guys should be getting all the credit in the world for putting these events on. So don't forget, the password for posting events, you'll see when you visit the site and you check out that section that it will ask you for a password in order to post your event. The password is healthy, all lowercase letters. We require a password because we don't want, crazy entries in there. We all know how the internet works these days. So just remember, it's the same password for everybody. It's healthy, but get in there and start posting your events. We're excited to start populating that map. So just in general, there are some easy tricks or 5 steps to success when it comes to hosting successful events. The first tip is to start planning early, and I congratulate everybody participating on the webinar today because this is absolutely prime time for when you want to start planning your events to guarantee that you're going to be successful. And you want to think about what type of events you want to hold. You want to create an invitation and consider putting together a sponsor list or a potential sponsor list. A couple of the other things that really help in making sure you can be successful is making sure that there's a team in place. We're all wearing so many different hats in our jobs and at home, but it's really important to have a group of people that are in a position to help put on a successful event. In some cases, putting together a committee, perhaps comprised of both board and staff or volunteers from the community, but I think creating a group of people who self-select to say, we really want to be involved with the planning and execution of an event. And that can also include local partner organizations. The only other piece is that you definitely want to make sure you have the support of your board and your leadership at the health center level, of course, because we all have to be on the same page about the direction that we're going. The next piece is outreach. I would say putting out invitations to all of your elected officials, not just federal folks, but also state and local. I think the sooner that you can at least get it on their radar, maybe it's just to save the date. But I think extending formal invitations is really important, and starting that process now is very helpful. The same thing is true in terms of seeking sponsors. What you want to do first, and we're going to spend some time on developing a sponsor list, but the first thing you want to do is develop a potential list of sponsors and start getting the word out about your plans for what events you're going to be hosting in the timeline and so forth. The next piece is the media. Working with the media, I think a lot of health centers shy away, and this is another one we're going to get into this a little more deeply, but it's important to make sure you're extending invitations to your local TV station, the radio station, certainly your local newspapers, and even, online media sources. Ask them to participate in the event. Give them a heads up what you're planning, and don't feel like you need to avoid them or shy away. They can be a really, really helpful partner in getting the word out about all the amazing work that you're doing at the health center. A couple of other things. Persistence. For anyone that has sat through a general advocacy training with me, this is a word that you will hear across the board when it comes to advocacy, and it certainly isn't any different when it comes to National Health Center Week. Sometimes it takes a lot of persistence, whether it be trying to confirm participation by elected officials or making sure that you have all the pieces in place to have a successful event. It requires some commitment and some persistence to make sure that all the pieces come together. Make sure that your communication plan includes regular updates to sponsors and attendees and the public. Again, it's just a persistent effort to make sure that they know this is going to be a really special, big event at your health center and that they should be involved. Help them to see the importance and the value in committing to participate in your event. And the last piece is thank yous and recognition for where you've been successful. I think without saying, it goes without saying that when it comes to attendees and sponsors, you always want to say thank you, and I think most of you on the phone know without my even needing to say that. But don't forget, I think sometimes when you wrap up an event, it's easy to just kind of take a deep breath and say, we're finished. But really, the process of saying thank you and recognizing the support that was provided is the last step in the process. So don't let that one fall through the cracks. And then I think the other piece, when you're expressing your appreciation to those who were supportive and or attended, and even for those who did not, letting them know how the event turned out. You know, do a little bragging. You know, this is the number of attendees that we saw here, or, you know, as a result of our event, these things happened, or we received this kind of media attention. You know, don't be shy about pointing out how successful the event was, no matter how large or small, because it's a really effective way to draw the attention of folks who may not have participated this year, but maybe you can attract their attention for the next year. So I want to spend a little bit of time talking about local sponsorships, because I get a lot of questions about it year to year, but I also think that we don't take full advantage in the Health Center world of all the support that's available to us. So National Health Center Week sort of provides a great opportunity to look at ways that we can be leveraging local support in the way of sponsorship. So the first thing is, there's lots of different types of sponsorship. It's not just about cash money, so to speak. There are in-kind sponsorships where perhaps the sponsor is not in a position to write a check, but they may be able to give you merchandise to give away at your event, or perhaps, you know, it's a local restaurant and they can provide food to cater your event. You know, sometimes grocery stores can provide refreshments and beverages. So think creatively beyond just, you know, cash and check, what kind of support you might benefit from to support your event. The other type of sponsorship is participation. We see an increasing number of sponsors who really want to be on the ground. You know, they send a couple of folks to be there to spend time in the community, but taking that a step further, some sponsors want to send an entire team of folks to support an event, and that can take the shape of, you know, maybe there's a community cleanup where, you know, they're sprucing up, the whole event is to spruce up the health center, and so a sponsor might send, you know, a team of 10 folks to help manicure the lawn or paint the waiting room or whatever the case may be. But just personal participation in the form of sponsorship can also go a long way. So again, just think creatively about what kinds of support can be helpful in terms of sponsorship for your events. And the other piece is setting goals. I think it's really important to go into your planning process and head into your event with some really clear ideas about what you think it's going to cost and what you think it's going to need. That's also going to help you when you begin the conversation with potential sponsors, because they may say, well, what can we do to help? And you want to have an answer ready to go, and whether it be in the form of a cash or check sponsorship, or if it's, again, will take the shape of, you know, we need some help with folks on the ground to help, you know, deal with intake or whatever. It depends on the type of event, but have an idea of what your goals are in terms of the costs and the types of needs you'll have for your event. And the other piece is, at the end of your event, or at the end of National Health Center Week, it's really helpful to look back and say, you know, what went really well? What could we build on? What would we scrap for the next year? And so I think it goes without saying also that when it comes to sponsorship, you want to set a reasonable goal year to year, but you also want to try to build on that. And so there's no reason why at the end of each year or each event you can't say, okay, this went really well, but let's do this next year. So the evaluation process is also really important. So when it comes to actually requesting sponsorship, there are some easy steps that can help in the process. One of the first steps is to take a look at who you work with and who your contacts are. So who knows you, meaning, you know, who in the community is aware of the health center, who does the health center work with, who do you partner with, who is currently supporting you. These are lists of folks and organizations and businesses that should be your first sort of go-to when it comes to a potential list of sponsors. The other thing is, as I said, to think outside the box, but think about what you need for your event. And then I think the other piece, as you're working through developing and recruiting your sponsor list, is it never hurts to ask for your sponsors' help in recruiting additional sponsors, believe it or not. That might sound counterintuitive, but you know, your local vendors and partners in the community have their own set of relationships, and so if someone has joined in support to sponsor your event, why not say to them, you know, we're really looking for additional help in this particular way, or, you know, if you have an opportunity to have a conversation about our event, we'd welcome, you know, additional sponsors. So don't be afraid to use them to add to the support for your event as well. So the other piece is doing your homework and being prepared. So it depends on who you're working with, but most potential sponsors, whether it's at the local, the state, or the national level, have a procedure for requesting sponsorship. It's really important that you do your homework to understand what that process is. It may include a formal letter of request. It might include a review, if you have done so, of the year's previous activities. You definitely need to be able to provide them with a list of the benefits that they are going to receive as a sponsor. So before you make that initial contact, it's worth taking a few minutes to investigate whether or not there is a procedure that they have in place so that you can be ready with the materials they're going to be looking for and easily respond when they say, well, have you taken these steps first? Again, and you're going to hear this many times, starting early will really serve you well, particularly as it relates to sponsors, because if you think of it in the context of when someone is establishing their budget, well, most of your potential local sponsors are establishing their budget for sponsorship alone, sometimes up to a year in advance. And so the sooner you can be in contact with them about sponsoring your event so that they can build that into their budget, the better. A couple other things to take into account is that you should be using your guest list, believe it or not, when you're thinking about leveraging local sponsorship. And what I mean by that is a couple different things. This actually goes also is the case with elected officials and how you might get them to participate. But what I mean by that is if you are asking for the support of a particular local sponsor, sometimes it's helpful to let them know who else is participating. It might sort of urge them a little bit more to want to participate if they think that the media is going to be there, for example, or certain elected officials may be there, or other community partners that they want to be in contact with. So it doesn't mean that you have to have confirmations from everybody, but you shouldn't be shy about saying, you know, these are the folks, the individuals, the businesses, and the partners that we have extended an invitation to and are optimistic they will participate as well. And the last thing is take what you can get. It sounds so basic, but you never know what an organization, a business, or an individual is in a position to provide, but take what you can get and then look at it as an opportunity, hopefully in the future, to build upon that. So again, just building off of the fact that, you know, we got to be thinking creatively when we talk about local sponsorships and sponsorship opportunities in general. And just remember that it comes in all shapes and sizes. So we've seen events over the years that have really taken this to a new level, but things like, as I said, local restaurants and grocers that are in a position not necessarily to provide cash or a check, but they can provide catering for your events, or perhaps they can provide fresh fruit or water, whatever you might need. A couple of other opportunities. I've seen many events over the years be in touch with their local police and fire departments to have staff on hand to support the event, but sometimes also something like, you know, if you have a children's health fair and there's a fire truck and the fire department is prepared to let the kids, you know, tour the fire truck as part of the event, my gosh, this can be an incredible draw in the community. It isn't a direct sponsorship in the traditional way that we think of it, but it's a really fantastic way of supporting your event and putting a unique spin on how the community will view the value of participating. So again, just remember, it isn't always about a check at the end of the day. That being said, there are a lot of folks in the community who you can and should feel very comfortable approaching to request a local sponsorship, again, assuming that you've done your homework. I think the first thing is, as I said before, to make a list of the folks, the individuals, the businesses that are working with the health centers. So that's everyone from banks to insurance companies, accountants, suppliers and vendors, partners. But make that list and then make a determination about, is the event that you're planning in line with some of the work that they are trying to do, and would it benefit them to be supporting and visible at these events? And then I think, you go from there. It's at least important to begin the conversation. There's no harm in asking. The others that it's, you never want to forget the regulars, so to speak, and that although the regulations have changed a bit, so the environment's a bit different for these guys, the regulars, but, drug representative, health plans, lab companies, these are some sort of obvious go-to folks when it comes to leveraging support for local events. And then, as I said, while we can't promise everyone that we can provide a local sponsorship, we really, really want to do everything we can to support your events. And every year we are fortunate to have more opportunities to be able to provide local sponsorships back in the community. So let us know what you're doing. Make sure you're posting those events so that we can make those connections for you. So I'm not going to go through this entire list, but this step-by-step guide, more or less, to seeking local sponsorship is available on the National Health Center Week website. It just walks you through, including a basic timeline about the steps that you need to take in order to leverage those local sponsors, including the very last piece, again, which is to say thank you after you've had your successful event. So moving a little bit beyond sponsorship to just the nuts and bolts of National Health Center Week, I want to tell everyone on the webinar today that as far as we are concerned at NAC, for a National Health Center Week event to be successful, it doesn't mean that it has to be a huge, overarching, costly event with a ton of people. It really can be something as simple and straightforward as working with your mayor to put up a National Health Center Week banner on your main street and hanging it for everybody to see for the entire week of National Health Center Week. That basically equates to the cost of a banner, but I tell you what, that's an enormous step forward for a health center that has never previously celebrated National Health Center Week, and it serves so many different purposes. It's alerting the community to the work that's going on at the health center. It's a great marketing tool, but it also lets everybody know that this is a week of celebration for all the incredible work that the health center is doing in the community. Now, I use that example again because this is not something that's elaborate or complicated or costly, but in my opinion, that's a very successful way to celebrate National Health Center Week event. So what you have up on the screen now is just a basic list of some of the events that we have seen over the years that have been really successful. By no means is this an exhaustive list. You can check out the National Health Center Week website for additional ideas, but the key message to take away from this is that big or small, it doesn't matter, the size of the event. It really, the success of the event has to do with doing something to recognize the good work of health centers. The other thing I'll say is that as you are planning your events, please let us know what you're up to, not just by posting the event, but if you feel like you've got a unique new idea for how you're planning to celebrate National Health Center Week, send us an email and let us know, because I would like nothing better than to showcase your new great idea nationally with our colleagues. We look for creative new ways to celebrate Health Center Week every year, and it's really a lot of fun to see the good work that goes on in the community. But I would just pull out a couple of these and encourage you guys to think creatively. Some of the really great events that we do see are events that recognize either the positive work and support of somebody in the community, or an anniversary of some sort at the health center. It could be a 10th anniversary, it could be an expansion of services at the health center. You may want to recognize a board member who's been serving as a board member for years and years. Hopefully you have at least one policymaker in your community at some level or other. Again, it could be local, state, or federal, to recognize their support for the health center. So again, I think anytime we're expressing appreciation for support, that goes a long way to drawing participation, but also continuing the support from that individual in the future. The other thing about these events to remember is that this really is meant to be a celebration. And so I think as much as you can, as you're planning, think about what you want to brag about, to be quite honest. The work that you're doing is incredible. I know that. I am so fortunate to be able to travel around the country and see health centers fairly regularly. I know all of the amazing work that you guys are doing, but definitely take advantage of Health Center Week as an opportunity to let the rest of the community know about the vital work that you're doing and to celebrate all the good things that you're up to. So a couple of other things, and I want to be careful because I want to leave plenty of time for Nina and Felix, but a couple of things for everyone to remember. Within National Health Center Week, we actually pick out a few days to recognize the work that health centers do to care for special populations. So the Tuesday of National Health Center Week, we have dedicated to recognizing public housing health centers. The Wednesday of National Health Center Week, we dedicate to the recognition of healthcare for the homeless at homeless health centers. And on Thursday of National Health Center Week, we are recognizing the work that is done to care for farm workers. So again, you've got the list there. These are also listed on the Health Center Week website. But for those of you that are grantees that address these particular populations, this is your special day to really show off the work that you're doing and to celebrate how you're caring for these special populations. So I encourage you to think about how you can utilize these special days within National Health Center Week to showcase your work. So getting back to, we started a little bit of conversation about working with the media when it comes to National Health Center Week. And again, I hear pretty often from health centers that there's some shyness about reaching out to the media in general, but certainly when it comes to National Health Center Week. And I just want to encourage you guys to take a deep breath and believe that you have the skills and that the media really can serve as such an important partner and tool to spread the word, again, about all the incredible work that you guys are doing on the ground. The trick is with media is they really, I think in terms of the relationship that you build with them, I would treat them the same way you do sort of your political folks, your elected officials. And that means that part of being successful in working with members of the media is working to build a relationship. If they know you and they understand the work that you do and have a basic knowledge of how the health center is so vital to the community because you've spent the time to build that relationship, they are going to be much more likely to want to participate and cover your events. The other piece is just a really simple one. It's extending an invitation. I think sometimes there's a misperception that the media will just know to show up. You know, they know what's going on in the community, and if they cared, they would come to our event. Well, sometimes they do, but I wouldn't leave it to chance. And so really the best approach is to extend an invitation to various media outlets and individuals where you have relationships in the media, and just ask them to come. Let them know what your plan is and encourage them to participate. And again, here's the golden rule. It's starting early. Sometimes when it comes to the media, they really are just looking for, you know, that day's big story, something positive, and certainly most of the time during National Health Center Week, we are the positive story. But there are other times where you never know. They could be putting together a plan to showcase different community partners or community services locally, and, you know, perhaps your Health Center Week event fits in perfectly with that plan. Or perhaps they build a plan around the work that you're doing at the health center. The point is giving them time to look at how this fits into the stories and the planning that they are doing will serve you well. So get an early start. The other thing in terms of working with the media is that we have tried at NAC to make sure that we provide you with all the tools and resources you might need to be successful in, again, sort of showcasing all the work that's going on and getting the message out about health centers. So with that in mind, we've created template press releases. We always put together National Health Center Week specific talking points, template op-eds and letters to the editor so that you guys have, you know, at least a basic framework for these types of media resources, and you can tailor it to fit your community, your events, and your health center. So again, you can access those. They are updated. We are lucky to have such an amazing team, has already put all those templates together for you. And the likelihood is you'll probably see an even more updated template as we get closer to National Health Center Week. But make sure to visit. You can see the website there on the slide. Make sure to visit the Health Center Week website and take a look at those templates. So in terms of other tools and resources that you can access on the Health Center Week website, we do, again, have the media toolkit and many different templates. We have a run-through of how to recruit local sponsors. We have listings of all different types of event ideas. We also provide template resolutions and proclamations, and this is a really great tool for everyone who is looking to interact locally with some of your elected officials and in some cases with your state folks. Obtaining a resolution for National Health Center Week or a proclamation for National Health Center Week is a big deal. It's really easy, especially when you have the template, to be able to take that to your elected officials and say, you know, we really want to celebrate this in the community. Would you be willing to provide a resolution or a proclamation? At the state level, sometimes it's helpful to work with your state primary care association to secure those. But again, you can access the templates right on the Health Center Week website, and it's a really great way to spread the word about all the great work that health centers are doing locally and across the state. And the last piece that we have on the website there is a listing of photos and videos and an opportunity for story collections that you guys can tell the local story. A few other options as you go through the Health Center Week site. We do have a National Health Center Week store. We have posters available in English and Spanish. We have banners that can be personalized with your health center logo. We have fans for those of you that are in very hot climates during National Health Center Week. This year we've added a bunch of low-cost items that can be passed out at your events, everything from chapstick to sunscreen to water bottles to kids' coloring books. You know, we've really tried to capture a lot of different items that may help to support your event and make it a little bit more fun for National Health Center Week. So definitely take a look at the National Health Center Week store. You can order whatever you like right on the site. And if there are items that you don't see on the store, again, don't hesitate to be in touch with us to make the request. Chances are we can probably put something together to make it work for you. So some other tools that we put together year to year are social media tools. For those of you guys that are on Twitter and Facebook and or have a health center website, we've tried to put together tools for you to support those things, again, including downloadable graphics that you can put on your website and or use for Facebook. And actually some of those are customizable as well. And I'll just point out, you'll start to see this a lot more often for those of you that are on the Twitter world. National Health Center Week, or NHCW 2014, is our hashtag. So as we get closer to National Health Center Week, you'll start to see that a lot more prominently. But I would encourage you guys, start using it now. We love to see it on Twitter, and certainly we'll be looking for Facebook posts as well. So, all right, so a couple last things, and I'm going to turn it over here. Once again, we will be launching both a picture contest and a video contest for National Health Center Week. We have revised and updated all of the rules and descriptions for those contests. And you'll see that the voting periods are listed there, but there's also a submission period, so make sure you check the Health Center Week website, the contest section there. But I really encourage you guys to take advantage of those. We've got some really great prizes for finalists and winners, but the big thing is that it's such a great way to tell the story about what's going on at your health center, how you're celebrating National Health Center Week, and all the great advocacy work that's going on around the country. So again, take a look at the Health Center Week website to get more information on those two contests. So we've lost the graphic there that actually shows you the fields that you can populate to share the information on your event. But once again, just as a reminder, the password is healthy to post your event information. There is an entire section of the Health Center Week website dedicated to those postings. If you have any troubles or you need any help, don't be shy about being in touch with us. Okay, so here is my contact information just for folks who don't have it, but you've got easy access to me as of now, as if you didn't before. But you see my email address there, my cell phone number. Any questions that you have, if I can't answer them, I have a wonderful team that I know is anxious to be supportive to you guys, and we really are here to help. And Health Center Week is by far one of my most favorite times in terms of the advocacy work that we do. So I look forward to hearing from you guys and building on the resources, quite honestly, that we've put together. So let me switch gears. I'm going to go ahead and bring up the next presentation and introduce our next two speakers. Dr. Felix Aguilar is the president and CEO of Yuma Community Clinic in Los Angeles. He was previously the chief medical officer of the South Central Family Health Center in LA. He's done extensive work in the community with a broad involvement with community health programs and community health centers. He's also been recognized as a visionary community health leader and executive by multiple organizations in the health field, including American Academy of Family Physicians, the American Cancer Society, and the U.S. President's Council on Service and Civic Participation. He also happens to be a graduate of our Advocacy Leadership Program. He's somebody that was a shining star right off the bat. We're so pleased to have him with us today to share about the successful event that he put on for National Health Center Week last year. And joining him is Nina Vaccaro. She's the Executive Director of the Southside Coalition for Community Health Centers, also based in Los Angeles. She's worked throughout the healthcare industry advocating for the needs of at-risk populations to include the severely mentally ill, low-income, and elderly immigrants and the uninsured poor. She has served as the first executive director for the Southside Coalition for Community Health Centers since 2006, and she is an absolute dynamo out in California. I know she was really the brawn behind pulling together a successful Health Center Week program of events last year. So with that, I will turn it over to Felix and Nina to share with us how they were able to put together such a successful event last year.
Hello, everyone. This is Felix Aguilar.
Hi, this is Nina. I think I'll kick things off. We can move to the next slide. So just to talk about some of the goals for the event and why we decided to do a walk for health. Each of our members of the Southside Coalition, and the Southside Coalition is a network of 8 FQHCs in the South Los Angeles area, and as most of you know, LA County is a very large area. So with about 10 million people in the entire county, South Los Angeles represents about 800,000 people. So we've got a consortia with the health centers that primarily serve the South Los Angeles area. And so most of our members participate in some type of activity individually throughout National Health Center Week. But as we started talking about how we could bring the health centers together and the community together, we thought that it would be great if we could attempt to do a walk. So we've now done 2 walks and have identified a set of goals. The first really is to raise awareness of the local health centers during the National Health Center Week, not just to our elected officials, but also to the community, to the other nonprofit organizations that serve the community that we're also in, and to the folks that live in the area. The second goal is to engage our local county supervisor, Mark Ridley Thomas, really in recognizing the work of the local health centers as catalysts of community health change. And Supervisor Ridley Thomas has served in a number of local elected offices, from city council to statewide legislation. And when he was at the state level, he really was a champion for health centers and provided a lot of fantastic legislation in support of community-based school health centers and wellness centers. So we really have an excellent partner in him in really recognizing the value of the health centers in the South Los Angeles community. And then the third goal really is to emphasize community participation, physical activity, getting our community out and walking together, and really recognizing that we can get out and take back our communities despite the lack of green spaces and safe places for a lot of people to go out and exercise and play. So the next slide. I don't think I have control of the slides.
Hey, Nina, I can do my best to troubleshoot here. I've got you on organizing the event and our partners. Is that the one you want?
I'm seeing goals. Yes.
Okay, I did.
Is that what everyone else is seeing?
Nina, you should be able to move the slides. You're the presenter.
There we go. Great. So organizing the event, this is definitely something that takes a lot of collaboration and partnership and planning far in advance. So Southside Coalition has taken the lead as the event partner in organizing everybody and keeping everyone coordinated and on task. UMA Community Clinic and St. John's Well Child and Family Center are two of the primary FQHCs in our membership that take a lead role in organizing the event with their fantastic staff. The Office of LA County Supervisor Mark Ridley Thomas, his health deputy team has been a fantastic supporter of this event, and then the Empowerment Congress. And the Empowerment Congress is a structure that was developed by Mark Ridley Thomas when he was a councilman in LA County after the race riots in the early 90s, as a forum in which we can channel activism and coordinate advocacy efforts in South Los Angeles. So they have a health committee of community members and nonprofit organization representatives that are also involved in helping us think through and plan the event. So how we organize the event, it takes us about 3 months of planning. We're actually in the active stages of planning for this year's upcoming Walk for Health. What we have to do far in advance is secure the venue for our health and resource fair. And so to give you a picture of the day, what we do is we start at about 7:30 in the morning at a local park, and we have vendors come in and set up for a health and resource fair that is at the end of our walk. We then have to secure space at St. John's, which has a very large conference room, and by 9 o'clock we've got walkers set up and ready to go. So we've got to secure venues and sites and make sure that we've got any permits that we need to be on public park space and recreation space far in advance. We then also have to coordinate with our local authorities, and we learned our lesson the very first year that we did this walk when we were getting ready to set out on our walk at St. John's Well Child and Family Center, and our local authorities, fire department and sheriff, showed up because they had seen all of our social messaging to advertise the event and asked why they weren't involved. And we got our hands slapped a little bit because we were going to be taking a lot of people out on a walk in crossing busy intersections. So we've now learned that we work with them in great partnership. They actually had some of their sheriff deputies out in civilian dress walking along with us last year, making sure that everybody was safe. They stopped traffic as we're crossing busy intersections and shut that down to make sure everyone's okay. And the fire department also escorts our walkers because it can get very hot mid-August in Los Angeles. Sometimes we've got temperatures in the early mornings in the 80s and 90s. So we want to make sure that everyone's okay, so the fire department is also on hand in case any of our walkers get a little too hot. We then also engage with our local YMCA, and they've got a lot of wonderful programs there, and it's an opportunity for them to showcase some of their exercise programs. So the YMCA is engaged as a partner to show up in the morning and lead all of our walkers through some gentle warm-up exercises and stretches to get them ready. And then we also spend a lot of time engaging the local nonprofits in the area and the health centers that are part of the Southside Coalition so that they can participate in the Health and Resource Fair. And it's really important when you're doing an event during National Health Center Week with multiple health centers that you're putting the date on their calendars early enough in advance so it doesn't conflict with any health fairs or events that they may be thinking about doing independently. And then also we're setting up a lot of time to conduct outreach to the local community members, neighbors. We work with some of the local schools. Sometimes Health Center Week falls before school goes back in. Sometimes it's the week that school starts. But we usually are pretty lucky in working with some of the schools to get some of the students out walking with us. We actually pass one of the local high schools along our route. And then working with some of the other community-based organizations to come out and walk or to serve as a vendor at the Health and Resource Fair. So organizing the event costs. Each partner that participates does donate staff time, organizational resources to planning and supporting some of the cost of the event. This also includes their outreach efforts among their patients, the local neighbors, and including some of the local business owners to let them know that we're going to have about 100 and something people walking by their business. Would they like to participate or contribute in any way, shape, or form? We've also been really lucky in having a very strong partner here in LA County with our local Medi-Cal Managed Care Health Plan, LA Care Health Plan. Every year that we've done the event, they have been more than happy to donate visors and sunglasses and free things that we can give out to our walkers to keep them nice and cool along the way. And they also participate in the Health and Resource Fair at the end of the event to give information out about the services that they provide as a health plan. The heavy lifting really comes from the county supervisor, Mark Ridley Thomas's office. They provide tables and chairs and audio-visual along with a beautiful table of fresh fruit and for the walkers and water along the way. They also help us with designing and printing the outreach flyers and getting those out to the community. And then a part of the outreach, which I didn't mention, is we really do use a lot of social media. We use Twitter, Facebook, we use our website, email blasts. The supervisor has a very large listserv that he sends this out to, and a newsletter that goes out, and we advertise the event in the newsletter as well. And so we, oh, it's unfortunate, it looks like the map that we had on here didn't show up, but we had a map that shows you the route that we take, and it's basically a 2-mile walk that starts at 9 a.m. It takes about 45 minutes to an hour for all the walkers to finish the 2-mile journey. And what we do is we start at St. John's Little Child and Family Center, which is one of our FQHCs. We walk through the community. We walk past UMA Community Clinic, which is about a mile away from St. John's, and then we end up at Mount Carmel Park for a Health and Resource Fair. So I think with that, I'll turn it over to Dr. Aguilar.
Here you see some of the photos from my event. It's really a beautiful sight to see all of these people walking down the streets, getting the message of exercise, but also of community involvement. And I'm going to show you also in the next one about we are doing civic engagement in the social determinants of health. We have partnered with local organizations working with the South Los Angeles Building Healthy Communities Initiative by the California Endowment. And basically, during the walk, we stop at empty lots to talk about how this lot can be turned into green space, community gardens, or other things. And the folks you see in the picture are from different organizations discussing some plans about those empty lots. And also, the walkers are encouraged to take notice of littered sidewalks, alleys, abandoned buildings, liquor stores, fast food establishments on the route. So the whole idea, again, is to include a variety of different things as we walk and try to engage also the elected officials on community improvement. This is a photo of, or several photos from the actual health fair and resource fair. And I got to point out the picture, the two people on the left on the top picture, there's Nina with the sunglasses, then you can see me on the green shirt. And we're receiving, and on the back is Jim Manja from St. John, he's the CEO. And Yolanda Vera is the health deputy, and she's presenting us a proclamation from the supervisor. And back, we were doing Cover California. Here at the bottom, you can see the fresh fruits and vegetables that were distributed. And we have 7 local health centers participating in doing health screenings, 14 community-based organizations providing information about healthy eating, health coverage, resources, housing, family planning, and public health, and about 175 people participated in all of the events. And so what is next? Here's our beautiful train coming to us on the week of August the 10th to the 16th of this year. We're planning our 3rd annual Walk for Health. We're looking to move the event. Instead, last year was on a Friday, so we'll move it to a Saturday to increase community participation. This time we have 3 staff that participated in the NAC's Grassroots Advocacy Literacy Program. We will work to expand the event and do more community organizing and to further integrate awareness of the social determinants of health into the event. And we will extend the time for the health and resource fair to incorporate health insurance enrollment related to the ACA. So with that, I need to emphasize what Amanda mentioned in the beginning, which was we submitted photos. I submitted a photo that I took from the event. It was selected as a finalist for the National Health Center Week calendar contest. I didn't make it in the calendar, so you won't see it in there, but at least it was fun to see it and to share it with other folks around the country. And that is our event, and we're looking forward to having more successful ones. So if you have any questions or any other comments, otherwise I thank you for your attention and participation.
I will also add that I do believe UMA took advantage of some of the resources that NAC had to get a small grant to buy some of the National Health Center Week fans, which were really important because we had a really hot day last year, and they really
that is true.
Yep.
That is correct.
Yeah, so this is Amanda. I will attest to that. We try really hard to put items on the National Health Center Week store that are not only affordable to you guys, but also make sense for your event. So, you know, if you're doing an open house or a house fair, or in this case, you know, where it is really hot in some places, those fans. But again, if you have ideas for other items and you don't see them on the National Health Center Week store or on the site anywhere else, you know, don't be shy about letting us know. And again, they are a great example. They let us know what they were up to, and we were able to connect them with one of our national sponsors for a local grant, local sponsorship. So we really do make the connection there, and we like to be able to support you guys locally and recognize all the work that you're doing. The only other thing I would just point out is that, as Dr. Aguilar mentioned, you know, the photos that are submitted as part of the picture contest, and again, we are running that this year, the winners are then the pictures that are selected as winners in the end will be used to create a National Health Center Week calendar. This will be our second year putting that together. We're really excited, and we're actually hoping to be able to expand to get that calendar out to more folks, but it is something that we make available sometime in the fall for purchase, and certainly to get out to folks that participated in the picture contest. But, you know, take a look at that and the video contest. We've had some really creative, awesome videos over the years, and, you know, it doesn't have to be, and in fact, we discourage super professional looking images and videos. We really want this to be grassroots, and it's great if you have an iPhone or, you know, smartphone technology, whatever you have, a flip cam, whatever, but don't be shy about recording those videos and getting them to us. And if you need any help in terms of editing or uploading, we can also assist with that. So we're getting short on time. If you have any questions, you can use the chat box in the system, or again, you can email us, and we're happy to get back to you directly. And I just want to take one last opportunity to say thank you again to McKesson as our premier sponsor for National Health Center Week, and to Nina and Felix for your incredible events year to year. I can't wait to see the success of this year's walk. And please let us know what we can do to be supportive. And thanks to everybody again who participated in the webinar today. And with that, I think I'm going to close us up because I want to be respectful of time. So have a great day, everybody. We'll look forward to seeing all those events posted on the Health Center Week coming soon. Thanks again.